All right. So, good morning, everyone. My name is Mogili. I'm a third-year medical student at the Icahn School of Medicine, and today I'm really excited to talk about global surgery with you all, and particularly our project titled "An Assessment of the Understanding and Fears of Patients Undergoing Upper and Lower Endoscopies in Rural Uganda." Right. And then I got to figure out how to do the next slide. All right, so the authors have nothing to disclose, and I'm really excited to share that Dr. Joseph Demoy and Dr. Angelica Jibwa, two of our finest surgeons from Uganda, have traveled all the way from Uganda to be here with us today. So shout out to them. All right. So, to get started, really, surgical capacity building is one of the next best, biggest frontiers in global health engagement. And, here at Mount Sinai, we've partnered with global surgical initiatives to help bring endoscopic and ambulatory surgical services to patients living in rural Uganda. This has proven to be a model for sustainable surgical infrastructure that has helped to bring, these services to patients who aren't able to access them in large population centers. Yet, despite all these amazing advantages, one barrier that still remains to be explored is that of the patient perspective. It's great if we can come in and, provide all of these amazing services, but if patients aren't able to understand or figure out what we're trying to show them, this might be a barrier to their participation in endoscopic procedures. Thus, based on conversations with providers and nurses at Chiburo Surgical Center, we wanted to establish and explore a baseline to understand what our patients know about these procedures and understand their perspective before we determine how best to continue to expand these services. So GSI, or Global Surgical Initiatives, is a model, like I mentioned, for sustainable ambulatory surgical care. They have performed over 4,500 procedures since 2019, and this is a wonderful picture of our center. And our study took place here, recruiting all patients who were scheduled to undergo an upper GI procedure or a colonoscopy that were over the age of 18. All patients received a standard consultation from one of the medical officers who went through the benefits, risks, and purpose of the procedure with each patient. After this consent, each patient then underwent a survey that was administered by a research tech in their patient's native language, asking them some questions about the procedure, as well as to assess their levels of trust, safety, and fear, as well as understanding. So getting into the results, we had 75 participants successfully complete the study with a median age of 54. Roughly half of them were female. A quarter of our patients underwent colonoscopy. And then, interestingly, 8% of our patients had actually previously had an endoscopy done. So moving into our multiple choice section, patients were asked 6 questions, as you can see here, and were given multiple choice answers. The data really shows that patients understand what endoscopy is, and they understand the purpose, as well as the preparation associated with it. Yet, some of the areas where they might not be as accurate are some of the common complications, whether you get a scar from an endoscopic procedure, and whether there are any limitations following these procedures. The median score on the test was about a 3 out of 6. Next, patients were asked to assess their feelings of safety and trust in both endoscopies and surgeries. Roughly half of our patients stated that endoscopies are safe, although a notable third disagreed with that statement. And then slightly less than half of our patients overall stated that they trusted surgery, although both of these are kind of confounded by this large neutral barrier. So I think a lot of patients weren't really feeling too strongly about one or the other here. Next, patients were asked to assess their fear from no fear to severe fear related to either getting anesthesia or getting an endoscopy. Here, roughly 83% of our patients reported fear with anesthesia and 87% of our patients with endoscopy, which is quite significant. And then notably, the patients in the anesthesia group are the patients that reported more significant severe fear with anesthesia than compared to endoscopy. Next, patients were asked to assess what they felt their understanding of the risks, benefits, and purpose of the procedure was. And as you can see here, patients reported a really good understanding of the benefits and purpose of their procedure. Yet, unfortunately, that might not have translated to the risks associated with the procedure. So what does this all mean? So, we do a really good job of explaining what endoscopies are, that it's a camera, that it goes in your throat, and it helps us kind of, determine what's going on in your body. And patients understand that and are able to communicate that to us. Yet, despite this, there's still a high level of fear associated with endoscopies and anesthesia. And that's something that's, interesting in the sense that we can't just focus our patient education initiatives on increasing knowledge of the procedure, but rather we have to specifically focus on addressing fears and patients' beliefs in order to really ensure that they're able to engage with these services. Additionally, education should be provided regarding the potential risks and to ensure that patients understand those risks as evidenced by some of the data that we presented today. At GSI, our plans moving forward with this data are to kind of develop some patient education tools that can be used in the perioperative setting that can involve videos and infographics and things like that that aren't currently readily available in languages and medias that are accessible to our patients. So with that, I want to give a huge shout out to our amazing staff at Chibira. They're truly some of the most amazing and fun people to work with. And open it to questions, and my email is there as well if you'd like to connect. So thank you. I really appreciate it.